Welcome back to Power and Politics. White House officials anticipate COVID vaccines will likely become like annual flu shots, largely due to newly updated COVID booster shots rolling out today in the U.S. Those boosters target both the original coronavirus strain and the current dominant Omicron subvariants.
And so we fully expect that the updated bivalent vaccines containing BA4, BA5 sequences will offer better protection against currently circulating strains than the original vaccines.
Barring those variant curveballs, for a large majority of Americans, we are moving to a point where a single annual COVID shot should provide a high degree of protection against serious illness all year.
Dr. Anthony Fauci heads the National Institute of Allergy and Infectious Diseases and serves as the chief medical advisor to President Biden. He'll be departing from both government posts in December. Hi, Dr. Fauci. Good to have you on our program.
My pleasure. Thank you for having me.
I appreciate you making the time, Doctor. I wanted to start off and ask you about the BA4 and BA5 vaccines, or vaccines rather, that target those specific variants. I heard you speak earlier today about your impression around their effectiveness and that they are likely more effective than the original vaccines that many of us were getting over the past few years. Why is that so?
Because it's directed specifically against the variant that is circulating now throughout the world. In the United States, if you look at the combination of BA4 and BA5, with BA5 being the most dominant one, it's well over 90% of all the infections that are occurring in the United States right now are BA5, with the lesser extent BA4. So when you have a updated vaccine that serves as a boost, as it were, and it's directed against the dominant circulating strain that's in society, you have every reason to believe that that is going to be better than having a vaccine that isn't highly specific to the circulating strain. It hasn't been proven in a clinical trial because we don't have time to do a clinical trial, because we need to get the vaccine out now, because we have such a situation throughout the world, and certainly in the United States. We're having 400 deaths per day and up to 5,000 hospitalizations. And that's predominantly very, very heavily weighted towards BA4-5. And for that reason, we have a matched, updated vaccine.
The original vaccines that we got were very effective at reducing severe illness and hospitalization and death. Their effectiveness, though, at curbing transmission waned over time. Will that change with these newer ones that are targeted because they are targeted to the variants and because that variant is so predominant right now?
I don't think we can say specifically or definitively whether or not we're going to have the same degree of waning of effect. We may not have as much waning because it's so specific to the circulating variant, but we don't know that. So we can't say that with any certainty. So we have to assume that since protection against coronaviruses wane, whether you get infected and induce an immune response secondary to infection, or whether you get vaccinated, we know from long experience now over the period of time from the vaccines being available in the beginning of 2021, end of 2020, until the present time, that unfortunately for us, the immunity does wane. So I would expect you're going to see some degree of waning immunity. And that's the reason why we said in the press conference today, we are moving towards a cadence that for most people likely will be requiring a yearly annual updating of a vaccine in order to account for what will be the inevitable waning of immunity.
Dr. Jha, who's coordinating the White House response, made that very point that you just did and said that it would likely be, one shot annually. Do you think that's a fair assessment? Do you think that's likely what we're in for the next few years at least?
I'd have to underscore the word likely. I think that's what's going to happen. But, we never know with this virus. We could have coming out of nowhere, the way we saw with Omicron, an entirely new variant that is very, very different from the variants we've seen. If that's the case, all bets are off. You're going to have to make a vaccine and deliver it as quickly as possible to direct itself against that very, very different variant. If, however, we have the continuation of either BA.5 or drifting away with some sublineages of BA.5 that are not very different from BA.5, then I think it's perfectly reasonable to assume that it is likely that we will go to this yearly updating a vaccine for a person, except under those circumstances for people who are either elderly or who have immunocompromise may require it more often than just once a year. But for the most of the general population, it is likely that that will be a yearly situation, very similar to what we see with influenza.
There are people over the last number of years who have become vaccine hesitant. There are people who have become outright anti-vaxxers. There are people who believe conspiracy theories. The idea of the vaccine itself has become highly polarized and highly political. How concerned are you about uptake for something like what you just spoke about, or even the bivalent vaccines?
Well, obviously, the idea of vaccine hesitancy or even outright anti-vaxxing is something that we're really concerned about here in the United States and in many respects throughout the world. We have to do much more effort in communicating in simple terms what the scientific data is. And if we can get people to just appreciate what the evidence is and not conspiracy theory, not made up things, but what the real evidence is, it points very strongly towards getting vaccinated and also keeping up with your boosters. If you look at the deaths and the hospitalizations and compare unvaccinated people with people who are vaccinated and boosted, the data are striking. You can't miss it. The deaths and the hospitalizations are very, very heavily weighted, much more towards the unvaccinated, unboosted people, as opposed to those who are vaccinated and keeping up with their boosters.
Much of that data has certainly been communicated in some way or another to the public. I'm wondering, just as you're getting set to leave this position, we hear that CDC say it will review its own way that it handled the pandemic, its communications. When you look back, knowing what you know now, especially where the sort of political aspect, the politicization, the polarization of all of this is concerned, when you think back to how you communicated things or your role, what would you do differently?
It's tough to figure that out because we tried to communicate as clearly as we possibly could. But remember, early on, particularly, we were dealing with a very dynamic, changing situation. And what the public has to realize, and perhaps we could have done a better job in trying to explain that a bit more carefully. We tried, but obviously we didn't fully succeed, that things do change. And the public expects science to be absolute and not change in any recommendations or guidelines. But when the data evolve because the virus is changing, then you have to change certain things, certain outlooks, certain guidelines, certain recommendations. That is understandably confusing to the public. So we likely have to do a better job of clarity in how we get that communication across.
Just a final question for you. I think a lot of people are asking, is the pandemic over? When will I know it's over? If someone came up to you on the street and asked you, when will I know this pandemic is over? What would your answer be to them?
Well, I think, I don't mean to be simplistic about it, but you'll know it when it happens, because right now it's disrupting the social order. It's disrupting society. When you get infections and hospitalizations and deaths to a low enough level that it essentially is in the background without disrupting, very similar to other respiratory infections that we deal with that don't disrupt us, parainfluenza, common cold coronaviruses, seasonal influenza. We would hope that they would be disappearing completely, but they don't. But they certainly don't disrupt us the way COVID has for the last 2.5 years. For example, right now we're having between 375 and 400 deaths per day with COVID in the United States. That is an unacceptably high level. So right now we know we're not there. We've got to get much, much lower than that before we can say we're in a steady state situation where we could live comfortably with this.
Okay, Dr. Fauci, I'll leave it there. Thank you very much.
My pleasure. Good to be with you.